What should I expect at a C&P exam for neck pain? A C&P exam for neck pain involves a series of questions to include a physical exam, diagnostic testing, maybe an x-ray if none's ever been done before, and a range of motion test with a goniometer. That's basically teeing it up. That's what happens in the C&P exam. Here's some common questions that are asked at a C&P exam for neck pain. Does the veteran have a diagnosis of a neck condition? Of course you do, because we've been talking about this forever. Diagnosis, symptoms, nexus. If you don't have all three of those, you have no claim. You're going to get denied. So yes, I do have a diagnosis. What's the history, including onset and course, of the veteran's cervical spine condition? When did it start? If it's a secondary condition, it could start anytime after that. If it's a direct service connection claim, that means that you're blaming it directly on your active duty service. Words matter. So that's another question. When did it start? How long have you had it? What's going on? Be prepared to answer that one. Does the veteran report flare-ups of the cervical spine? Does it flare up? I know mine does. I can't tell what my flare-ups are going to be. And then this might be a good idea to keep a log. I talk about, there's an app called Migraine Buddy. It's a good log for migraines. But really, when you're dealing with any pain, you should keep a pain log. Because when you're like, do you have flare-ups? Yes. Well, when was the last flare-up? Like you're in a C&P exam all nervous, like, I don't know, like 10 days ago. If you have a log, last flare-up was 10 days ago. Before that, it was 13 days ago. Before that, it was 19 days ago. A log of any kind, spreadsheet, write it on toilet paper, whatever. You could probably track it in Migraine Buddy. Keep a log when you're dealing with anything that has to do with flare-ups. Mental health is included. Just keep a log. Keep a log of all your pain and all your problems. They're going to be checking the frequency, duration, and characteristics of your flare-ups. So there's you now. You may be having a flare-up at the C&P exam. Typically, that doesn't happen. But they should ask you about it. If they don't, make sure you start talking about it, because you want to talk about your worst day. If you're feeling great, which you shouldn't be in a C&P exam, you want to be talking about yesterday or a week ago, whenever your worst day was. Does the veteran report having any functional loss, functional impairment of the joint or extremity being evaluated on the questionnaire? Is it limited or not limited to repeated use over time? So if you have functional loss, the doctor's going to ask you to describe that in your own words. You should be prepared to talk about this. Is there evidence of pain? If yes, select all that will apply, right? Weight bearing, non-weight bearing, active motion, passive motion. Active motion is, moving your neck. Passive motion is just sitting there. On rest, does it hurt when you rest? Yes, when I lay in bed. Non-movement. So they're going to be checking, if you're just standing up, moving around, if you're standing up, not moving your neck around, or if you're resting, like laying down, does it hurt there? So they're going to be asking questions like that and filling these things out for you. Be prepared. Get the DBQ for neck pain and study it, because these questions are coming at you. Does procured evidence, statements from the veteran, suggest pain, fatigability, weakness, lack of endurance, or incoordination, which significantly limits functional ability with repeated use over time? This is where you put your personal statement in, talking about your disability before you file your claim. You do all your medical evidence at the beginning. You don't do it halfway through. You already hit the submit button. Now you got to wait for them to make a decision. You don't get to fix it. Fix it and do it right the first time before you hit the submit button. So they're going to be looking at your personal statement. You don't need to write a book. Yes, I have weakness. I combat Craig. My life fucking sucks. I can't move. I'm in pain all the time. I can't walk. I can't lay down. I can't do anything I like doing. And I could barely move my neck around. That would cover about 6 or 7 of them. And I could get that done in 2 sentences. Write more if you have to, but your words will be used against you. This is an example. The C&P examiner is going to be looking in there at your personal statement and see if that matches up with the story that you're saying right now in front of them. Your story. You may just call it a disability. That's fine. Call it whatever the fuck you want. It's your story. You better have your fucking story straight before you go into that CNP exam, or he's going to tear you apart and you're going to be inconsistent. Memorize your story. Don't mix up and have 3 different stories. Don't mix this with that and the other thing. Get one story, stick to it, and then you won't have to worry about it. It's consistent in your personal statement. It's consistent when you talk to any doctor. VA Rater goes through and looks up any medical record, story's the same. Pain's an 8, always an 8. Never a 7, always an 8. Or whatever. They're going to write down if you're being examined during a flare-up. Are you having one or not? Tell them. Does the veteran have localized tenderness? He might, touch you. Don't let him move you. Don't let him start cranking on your neck. Is this tender? Kind of like a fibromyalgia test or something. Do you have muscle spasms of the spine? Does the veteran have any other additional contributing factors of a neck or shoulder disability? Does it interfere with sitting, standing, laying down, atrophy, swelling, deformity, less movement than normal, more movement than normal, your movement's weaker than normal? Does the veteran have muscle atrophy? I know for sure I have that. Do you? Does the veteran have radicular pain or any other symptoms due to radiculopathy? You either do or you don't. Again, objective medical evidence is best. There's no better medical evidence for radiculopathy. Let me jump in here real quick and tell you about my boot camp. If you want to learn more about the VA claims process, check out my boot camp. You can talk to me live. There's a link on the website and in the description, combatcraig.com. And also, if you need medical evidence like a nexus or documenting your symptoms properly, go to our website, combatcraig.com, and it says medteam/nexus letters. Click on that link, fill out the form. Boom, you're done.